Hi, welcome to the Greensboro Doula YouTube channel. My name is Sandra Nishihata and I'm the owner of Greensboro Doula, your doula agency in the Triad. This is the second part of the epidural video, and we're talking about what epidurals are in general and what the risks and the pros and the cons are. So let's talk a little bit about the relief that an epidural can give you in comparison to other pain reliefs or narcotics, for example. So an epidural is a pain relief which gives you the chance to stay alert and awake without being drowsy during labor, and even if you I'm getting a C-section along the road, the epidural can be used to prepare you for your cesarean birth. So there is no need, unless there is an emergency, to place a different kind of anesthesia. So the downside of an epidural is that you cannot move anymore. So while epidurals are used a lot to give you some rest after long labor, or when the sensation and pain of labors are not standable for you anymore, you can lay down and you can sleep. The epidural can be adjusted in the way you want and need it. But also you're not able to get out of bed anymore. So every position change that you were planning to do to labor your baby down are not going to be possible anymore because you don't feel your legs. And while we are able to work together with the hospital and with the nurses and give you as doulas some chances to move eventually on your hand and knees, or do a sitting squatting position, lay you on your side, you are not allowed to and not able to use the bed, to leave the bed. Also, epidurals can cause epidural headache, which is pretty common and usually goes away after a few days. And the ultimate risk is paralyzing, because something in the spine is going to be damaged, which is very rare and usually not happening at all. And so it's not really something that you need to freak out about. An epidural can cause your blood pressure to drop very fast. The good thing is about an epidural is it can be reduced because it's going to be adjustable as it's coming. It's going to be put in your body, and they are admitting the medication continuously, and it can be get up or down, so you are feeling to your comfort level. If your blood pressure would drop, you would need to be treated with IV fluids, oxygen, or something that your care provider is prescribing you. You have to be moved around during your epidural because it's gravity based. So if you would just lay on your right side because you're comfortable there, your right side would be numb, but you would start feeling on the left side. This is why the nurse might turn you around after a certain amount of time. Some women have described that having an epidural makes it more difficult to push because they don't feel the urge to push that much. It depends a little bit on the dose of the epidural. So these are the pros and cons. Ultimately, you have to decide that with your care provider and talk with him about risks and benefits. Make sure you ask him about that. Be prepared for your epidural, and don't inform yourself at last minute, because you never know, and it's always good to be prepared. Have a good day, and check us out under greensborodoula.com. Bye-bye.